Afternoon or good morning, depending on where you're at. This is Jennifer Spiegler from Kognito, and we are bringing you a wonderful webinar event today. We have a great panel. We have folks, we know it's a great panel because we have so many folks who signed up from all over the United States, from so many different organizations. There's really an overwhelming response to this blue chip panel. So thank you all for coming. People are still logging in. I see them jumping into the webinar now. So have to do that before we launch into anything really important. I will say though that we have a unique format that we've been working with here on some of our webinars, which is a panel format rather than a series of discrete presentations. This is more of a conversation. Each of our panelists will sort of lead one of our topics. These are very high-level topics on innovation in school mental health, but we'll have some redirects and some follow-ups. There won't be any formal slides. So we like the way this works and the way this rolls and the way that this allows a conversation to start. So let me cover a couple of housekeeping details. The presentation is being recorded, and a copy of the presentation, and again, there are very few slides here, so it's really just the topics that we're covering, will be sent to you. In addition, there is on the right-hand side of your screen some resources that our panelists will be sharing, and you can click on those and download them and have them to refer to. We'll put those in the follow-up email as well. You are in listen-only mode, but we do want you to contribute, so please take a minute now to use the question prompt at the right-hand side of your screen, and you can say hi, or you can tell us what's on the top of your mind in terms of challenges for school mental health, or something really innovative in school mental health that you want us to know about or you think is worth sharing. And we'll see whether it's something we're covering today. You can also connect with us on Twitter. We're using the hashtag Kognito Webinars, and we hope that people will use that social venue to communicate as well. So I think we'll go ahead and start. Today's webinar is entitled Innovations in K-12 School Mental Health. And we thought this was a really good time to sort of catch up on where we are with school mental health. A lot of things are changing on the policy side, on the side of how we do healthcare. It's an election year and we're about to transition yet again, but some of the current administration's efforts, like the Every Student Succeeds Act and ACA, are having an impact on school mental health. There is a whole movement about school mental health and performance and sustainability that the Center for School Mental Health has been working on, sort of bringing that whole arena to gel, and we'll talk a little bit about that. And we'll also talk about students and how students are becoming involved in school mental health. It's not just on the policies and on the professional side of things, but really looking at families, citizens, and students. So again, I'm Jennifer Spiegler. I'm the Senior Vice President for Strategic Partnerships here at Kognito. And for those of you who don't know us, and I know lots of folks on the phone do because I recognize your names, but for those who don't know us, we are a digital health education company. We have simulations for professional development and curriculum in the area of mental health and bullying prevention that we hope you will become familiar with, and that we've already used to educate over 200,000 school teachers and staff, thousands of students, and now also some of the nurses, social workers, and other health providers that are interacting in our schools. So without further ado, let me introduce you, or let our panel introduce you to themselves. Let's start with Olga Price.
Good afternoon. Thank you so much for having me. My name is Olga Acosta-Price. I'm an associate professor in the Department of Prevention and Community Health at the George Washington University. I also direct a center here at GW called the Center for Health and Healthcare in Schools. I'm a clinical psychologist by training, and my research and program development area is in school mental health. The current center that I direct is really about promoting child wellness and school success by really working with communities and trying to elevate some of the collaborative solutions that they bring forth that bridge health and education, so that where stakeholders and leaders at state and local levels have really come together to try to bridge what is often a gap between health, public health, and education. We're a long-standing technical assistance and resource center and policy center that's housed in here in our School of Public Health, and we really look to advance school health programs and policies by connecting these sectors, healthcare, public health, and education, so that we're really touching kids nationwide and really encouraging their development and health and motivation to learn. We really focus much of our efforts on thinking about how to address the social and environmental determinants of health and education, which are often similar, and on the risk factors and protective factors that might support or undermine well-being. As it relates specifically to school mental health, in addition to supporting kind of the delivery of high-quality clinical services in school, we're strong advocates for a public mental health approach, really looking at delivery systems and on infrastructure development and capacity building to support care across the continuum of care and prevention, so that we're thinking about mental health promoting interventions, universal, selective, and indicated prevention strategies, so that we're really addressing the emerging or pressing needs for all students. So I'll stop there.
Great, thanks, Olga. And let's go to Jill.
Hi, everyone. Thank you for having me on the panel today. I'm glad to be speaking with you all. My name is Jill Bonenkamp, and I'm an assistant professor and core faculty at the Center for School Mental Health, which is housed within the Division of Child and Adolescent Psychiatry at the University of Maryland School of Medicine. And our Center for School Mental Health was founded in 1995 with funding from the Health Resources and Services Administration, and continues its funding from HRSA. The mission of our center is to strengthen policies and programs in school mental health to improve learning and promote success for America's youth. And our center focuses on research, training, policy, and practice in comprehensive school mental health. And as Olga spoke about, we define comprehensive school mental health as a full array of services from universal promotion all the way up to Tier 3 interventions and everywhere in between. We focus on school and community partnerships that are guided by students and families, and focus on evidence-based programs. So that's when we think about comprehensive school mental health, that includes all those components. And I look forward to talking more about some of our exciting innovations that we are a part of.
Fantastic. Let's go now to Stan.
Good morning. Thanks for having me. So my name is Stan Collins, and I work on the Directing Change program and film contest, which is part of Each Mind Matters, California's mental health movement. So it is a program, a statewide program in California that invites youth and young adults to submit 60-second films in one of three topics, either about mental health or suicide prevention. And last year we introduced a new category called Through the Lens of Culture, where students can submit films about mental health or suicide prevention, but told through the lens of a culture, specific culture. So we're looking to expand the program into other states, into other areas, and we're going to be watching one of the films later. But it's just a way to engage youth around the learning objectives of mental health and suicide prevention through the creation of film.
Thanks so much, Dan. And now let's go to Beth.
Hi there. Thank you so much for having me. I am Beth Wolf, the Director of Programs from the National Alliance on Mental Illness California, which is NAMI California for short. For those of you who aren't familiar with NAMI, NAMI is the nation's largest grassroots mental health organization, which is made up of individuals and family members whose lives have been touched by mental illness. And there is a state NAMI organization in each state and then local affiliates within that state. In California, we have 62 local affiliates and a membership of over 19,000. And in my role, I oversee and develop programs that are offered throughout California. We have programs for families, individuals, communities, and then my personal favorite are the programs for youth and young adults, which is what we are going to share with you today. Thank you so much for having me. I'm looking forward to our discussion.
Great. Thanks, everybody. And, you know, we're so honored and delighted to have this panel with us. We really, really thank you for taking the time, both yesterday when we initiated this conversation and today and prep time. So thanks to all of you. Let's go now to some of the topics that we want to look at, and you'll see that they go from this very broad how public policy is impacting school mental health to what's happening at schools and districts in terms of their policies, performance standards, financing, and sustainability, to talking about school and community partnerships and how that can be used for supporting school mental health, and then what about students themselves, about engaging students and empowering the next generation of citizens and stakeholders in this conversation to really transform how we're thinking and behaving with regard to school mental health and all mental health. So to get going, I want to let Olga kick us off talking about public policy and school mental health.
Terrific. So I wanted to just share a few, I think, exciting opportunities that many folks in school health have been eager to see implemented. Certainly, I'm sure that there are many state and local policies that are being enacted that are impacting how school mental health services and programs are kind of rolling out in your communities. But in terms of two federal policies that you know, are worth mentioning and I think have some really powerful potential for advancing school mental health are both the healthcare reform as well as the Every Student Succeeds Act, which is the newly reauthorized Elementary and Secondary Education Act, the law which really drives federal education funding and accountability for the education sector. And it really represents an important opportunity to address the well-being for all children, and particularly a number of provisions, which I'll mention in a moment, that may help support the proliferation of school mental health. So in Congress signed ESSA into law in December of 2015, so regulations are still kind of being developed, but the law outlines new requirements. There are certainly a number of things that have remained from the No Child Left Behind, which was the previous law, and certainly some important provisions remain. But there are new requirements for statewide accountability systems, giving states much more discretion and authority to design and choose the kinds of indicators that they're going to put in place to determine how successful they are, which includes at least one non-academic indicator of success. So now states and districts must incorporate non-academic indicators in their accountability systems, such as measures of school climate or safety, student and educator engagement. So these are really interesting kind of new, it's not that districts and state education agencies have not incorporated these at all, but that was really left at the discretion of those education administrations, whereas now their ESSA is requiring that there's at least one non-academic indicator of success, although not weighed as heavily as the academic indicators. Incorporating these can really help drive more of a whole child approach and really encouraging school leaders to think about conditions for learning that are necessary for academic achievement. So what we're talking about in particular is that I'll mention one provision which remains within the law in ESSA is Title I funding, which is really the largest, I believe still the largest funded program within ESSA, which is a federal program providing funding and support to school districts to improve the academic achievement of designated disadvantaged students. Now states have to reserve 7% of their Title I funding to support school-wide improvement efforts kind of across the state. And previously, a school-wide program was allowed when a school had at least 40% of the students enrolled who actually met criteria for poverty. They could apply for Title I funds to implement school-wide interventions so that all students, regardless of where what criteria they met for free and reduced lunch, that all students could receive services funded by Title I. Now ESSA allows schools with even under 40% of students from low-income families to decide if they want to put in a waiver from their state education agency to implement a school, which allows more flexibility in that regard. But why that matters is because the kinds of activities that could be funded using Title I funds include counseling, school-based mental health programs, specialized support services, mentoring services, and other kinds of strategies that would improve student skills outside of the academic subject area, and that these services could be delivered by partners, by nonprofit providers in the community that have expertise using evidence-based or other sort of best practices to improve student achievement. So it's important that it's explicitly stated in the law that school-based mental health services, again, could be the kinds of programs that communities and education leaders might advocate for implementing using Title I dollars when they deem those kinds of supports and services necessary. And again, just to mention quickly with regard to ACA, again, a very important health policy that has allowed us to really think about how to address parity between medical, surgical services and behavioral health services, and with a strong emphasis on expanding health care coverage, particularly for vulnerable populations, which again are the kinds of communities and public schools that would want to consider and have incorporated school mental health services within them. So I'll stop there.
Great. Thank you, Olga. I wanted to go back and just ask you a quick question about whether you have seen schools and districts gearing up to embrace these opportunities that are being sort of unleashed under the new ESSA regulations, or you think that's going to come along in the 2017-18 school year?
Yeah, so I think there's certainly a lot of, and both within the education and the health communities, there are, and in some places really coming together of those professionals and advocates to, because for both of those laws, but particularly for ESSA, there's a real stipulation that for some of the provisions, there needs to be engagement of community, particularly of families, and in some of the decisions that are being made around indicators, around programs, around strategies. And so I think that is really strongly encouraging folks to come together at a local level to really do the planning. So I know that in our communities here, both in the schools where my children go, but also in the schools that I work with in those districts, that they have begun conversations, town hall meetings, a number of places where they are talking about and how might we decide what success means for us? What are the important gaps in education and disparities in education that we need to address, and what are the resources that we have, and how might we start disseminating them in an equitable way? And so these are definitely conversations that have been going on, but now they are, I think there's more urgency to make sure that that those are happening collaboratively, because the implementation will need to begin in terms of the accountability, I think, by the 2017 school year.
Great, and I think accountability is a really good place to shift the conversation over to Jill to talk a little bit about policy, performance standards, financing, and sustainability that the center is working on and so concerned with. Jill, can I hand it over to you?
Yeah, that's great. Yes. And yes, I think we have a real opportunity with the provisions of ESSA, and they really mesh nicely with the work that is funded through HRSA, through the Health Resources and Services Administration, that we are really at an exciting point in policy for comprehensive school mental health, and for being able to document and to improve high quality services and to expand the reach and the sustainability of those services. So I'm going to talk just a little bit about what those current efforts are. That there is not to date a school mental health census, so a tracking of comprehensive school mental health systems across the United States. And there have been efforts in the past to attempt to track this information, but this is really the first national census of school mental health, and this is currently ongoing. This, in combination with national performance measures, which I'll be talking about in more detail, are really an exciting opportunity for us to get both a sense of the scope of school mental health across the country and also be involved in advancing high quality services and sustaining those services. Both the National School Mental Health Census and National School Mental Health Performance Measures, both quality and sustainability, are housed on the shapesystem.com, and that website and link is also in your handout that's on the webinar. And that's the shapesystem.com, which stands for the School Health Assessment and Performance Evaluation System. And so schools have the opportunity across the country to participate and be counted in the National School Mental Health Census. And I encourage any folks who are on the line right now who are in schools, work within schools, or have children in schools, we're asking that anyone can participate and join us and answer a few questions about school mental health at your school or district and be counted in the National School Mental Health Census. There are also opportunities for schools and school districts to achieve SHAPE recognition and increase opportunities for federal, state, and local grant funding by completing the full census, which you can do by registering for the SHAPE system. But encourage folks, a very easy first step is to join us, and that allows you to hear more about additional resources that are coming forward related to the census and performance measures, and also be counted and have your school counted in the school mental health census. So let me tell you a little bit more about the performance measures. Standardized health performance measurement has increasingly become an imperative for assuring quality standards in national health. And as compared to sympathetic health performance measures, behavioral health is less developed. And prior to this date, there were no national standardized performance measures for monitoring comprehensive school mental health in the United States. And drawing upon related initiatives in school mental health and national performance standards for behavioral health care in non-school settings, we have developed national performance measures for school mental health quality and sustainability. And both of those measures are available for schools and school districts to complete, to rate their quality improvement and sustainability. And those are both available on the shapesystem.com. And these are really fantastic resources for schools and school districts to be able to determine where their strengths are within their system, but also to be able to understand what areas of growth are necessary in relation to those domains that are really critical for both high quality services in the quality performance domain, and also for sustaining those services over the long term. And we know that that sustainability piece can be more challenging, and the sustainability assessment considers not only financial pieces that are essential to sustainability, but also those non-financial factors as well. In addition to being able to complete these self-assessments and complete the quality and sustainability self-assessments, there also are a number of resources that help systems, once they have completed the performance measures, to then have a better sense of how they move forward within their system to improve both their quality and sustainability. So it's an exciting time, given that there's this focus and there's this opportunity within ESSA and other policy pieces to have school mental health on the forefront, that there are really great tools and now available now for us both to understand what the scope of school mental health looks like across the country through the school mental health census, and also for systems to be able to improve their quality and improve their sustainability.
Great, thank you so much, Jill. And I think Olga has a question she'd like to, or some remarks she'd like to add.
Yes, thank you. I just want to say that certainly the resources that are coming out of the School Mental Health Center in Baltimore are really important. They're very timely to really advance school mental health nationally. And I wanted to just make a point about sustainability that might also lead us a little bit to the next conversation about school community partnerships, in that one of the things that also is available, and a free online resource that is also listed in the handout we call the Action Guide, was developed really in response to the fact that many communities, in trying to very effectively identify where there are school mental health needs in their schools, in their districts, identifying the best evidence-based programs that may be available and implementing those to the best of their ability in terms of fidelity. In that many times we have many examples of where that didn't ensure long-term sustainability of those programs or practices. And so one of the things that we've learned from providing TA for many communities around the country is the importance of really thinking about these school community partnerships, and in an effort to really leverage important financial and policy opportunities, and to really think about sustainability as a complex kind of set of endeavors that includes money and funding, which is important, but it really, as Jill had said, goes beyond that to really think about institutionalizing effective practices, to build capacity, and to think about ways that sustainability really moves from just something that is the responsibility of those within the school building, but that relies on important connections from the school to community, meaning to local and state government, to nonprofits, to other health networks, and to families and young people in terms of really being able to sustain innovations in school mental health. So the Action Guide is this online resource that really provides practical information for communities. It kind of helps you think through a process for building and strengthening school and community partnerships in an effort to really take advantage of all of what may be available to sustain your efforts. And so it really sort of walks communities through how to build allies and their action teams, and how to engage those individuals and organizations, about how to really map assets and resources that are available, connecting to the policy environment and to opportunities for financing that may be available local or statewide, and then really communicating some of the successes and mobilizing partners and the public to really support whatever that school mental health agenda is. And so, again, that's listed in the handout, but I just wanted to mention the importance of school community partnerships in these efforts around implementation and performance standards and sustainability.
That's great, and thanks for taking us to the next bullet point, because that's really where we need to go. I want to hand over to Stan, who also wants to add to this conversation.
Yeah, thanks. So I think one thing when we're talking about efforts for mental health or suicide prevention in our schools, I think a lot of times we end up tying these roles to an individual at the school. A lot of the schools that I work at, there's kind of one person who runs all the kind of mental health outreach and efforts. And to be truly sustainable, what we need to do is tie those type of activities to a position, not to an individual. As we all know, there's turnover. There's going to be a lot of individuals in education that are going to retire over the next few years. And so for these efforts to make sure that they don't get bogged down if the funding goes away, and that we stay vigilant on mental health in our students, it's important for us to, again, tie those to the position, not the person, but also look at our board policies and administrative regulations inside of the school, and see where are we in regards to our policies about mental health, about suicide prevention. A lot of times when I work with schools, if they have policies around mental health or suicide prevention, maybe they're 10 or 20 years old, or maybe they're daunting where they're 20 or 30 pages, and you really want to have very clear, concise, and by integrating those into your board policies and administrative regulations, you'll make sure that these efforts are not tied to just the climate of the day or the climate of the year, that they really are continuing to build an effort moving forward.
Thanks, Dan. I want to jump in because we have some comments that I think are helpful here. One of which is the struggle that people have in identifying which evidence-based practice to go to. If you're in the field, is that something that is the best place for them to go somewhere like the Action Guide, Olga, or someplace like, I know the Suicide Prevention Resource Center has a lot of things, but we talk about evidence-based practices. Where are the shortcuts for folks?
And so certainly, I'm sure probably Jill maybe has some things to add, and the center at Baltimore, University of Maryland. I'll say that there are a number of registries, national registries, that really have done some of the work for us, identifying some of the most, the programs and interventions that had evidence tied to them. And so that's, there's NREP, and there's a number of other registries that certainly we could make available if we provide the handout. But I think part of what the trick is and what's difficult is again, the Action Guide speaks to a process where one would use partnerships and be making those decisions with important critical stakeholders around what are the important aims and objectives of the programs that we're trying to implement, and not doing them in isolation or having one institution or agency making some of those determinations, because the success of those programs depends in part on really understanding context. What has to be adjusted, what are the sort of culturally responsive revisions that have to be made so that it really fits our community and our target populations, and what are the resources necessary to make this an effective intervention here, and do we have all those resources? So I think that there are a number of decisions that need to be made. There's certainly really many really good programs across the K-12 spectrum that can be implemented in schools and have been tested, but I think another discussion is that it's about, really customizing those and making sure that you understand how they might fit, and that's best done when you're really bringing together these school community partnerships that really have to also include families and young people, which I know we'll talk about later.
Yeah, and I think Jill wanted to add something as well.
Yeah, absolutely. I think Olga mentioned the Substance Abuse and Mental Health Services Administration, or SAMHSA's NREP, which is their National Registry of Evidence-Based Programs and Practices. And this is a great resource where you can search for evidence-based interventions based on your target population or the diagnosis or group that you're hoping to serve. And I think Olga made some great points around thinking about what some of those considerations are when you're making sure that you're selecting a program and adapting a program that best fits. Another one of the website that or a registry that provides information around evidence-based programs is called the Blueprints program, and it's Blueprints for Healthy Youth Development, and it is a similar type of registry where you can look at different types of evidence-based programs that exist. And just to dive in a little bit more, when you're thinking about selecting evidence-based programs, that's actually one of the performance domains that's included in the National Quality Performance Measure. And so there actually are a number of resources when you're thinking about the evidence-based practice domain, where you can think about what you would want to consider when selecting programs, and a number of resources that are included within that assessment, and then after you complete that assessment on the SHAPE system to help guide your selection of evidence-based programs.
That's great. And just to let people know, because they're asking, all this information will be, the specific information will come to you in follow-up emails. Some of it's on the handout that is available to you on the right-hand side of your screen under. I do want to go ahead and move on to hand over to Stan to talk about engaging students.
Great, thanks, Jennifer. So I think when we talk about engaging students, to go back just for a second to our previous point, is that when we're rolling out mental health activities or awareness activities to our youth, to our staff, we want to make sure that we have the policies and procedures and all the safeguards in place first before we move forward with activities. And I think, a lot of us on this call are familiar with some of the statistics around mental health regarding youth, just to name a few, that majority of mental illnesses will show up in the younger ages, but typically there's, 6 to 8 years of delay before they get the proper care. That most youth will tell someone that they're thinking about suicide, but less than 25% of those friends will go on to tell an adult. And so I think getting information directly to youth is a very important part of any mental health activities that we're doing on campus. But I think it's also vital that we not just make it a mental health day or a mental health week, that those types of awareness events are useful, but they need to be part of a larger context of throughout the school year, being vigilant and working with our students so that they know that mental health is something that we as a school community care about just as much as their physical health, just as much as their performance. And I think it's also important that we examine some of the messages that we're putting out to youth. The National Action Alliance for Suicide Prevention created a framework around messaging for suicide prevention. There's similar efforts in regards to mental health, but we want to be critical of the messages that we send out. For example, if we're going to put posters on campus around seek help if you're feeling depressed, or if you think you're having any symptoms of depression or mental illness, we might not want to show a picture of of a kid who is sitting with their head between their knees and a hoodie over their head, because that kind of sends the signal that, this may not get better, you're in pain, where we want to focus more on images and messages of hope that recovery is possible, that this is something that a lot of people deal with and you're not alone. So I think it's important that when we're reaching out and engaging youth that we be critical of our messages, we make it vigilant throughout the year, that it's not just one day or 1 week, and that also that it's based on having the protocols, policies, and procedures in place to safeguard our youth, because inevitably we're probably going to stir up some emotions in those kids, and if we're asking them that it's okay to ask for help, we need to make sure that we can offer the help when they come.
Thank you, Stan. Beth wanted to follow up.
Thank you. And just to kind of piggyback on what Stan was talking about in regards to engaging students and reducing stigma, in our work with students and in many trainings we've been in with students, when we get to the topic of stigma, even after discussing it at length for a while and having some interactive discussions, there's still some confusion about, well, what does that actually mean to be stigma-free? Or what can I actually do to not support stigma? So we need to be really, really concrete with our examples and with our directives to students about how can they be and create a more supportive and welcoming environment on their campus for people who are touched by mental illness and for their family members. So we would just encourage everyone to really think of that when you're having those discussions, and not just leave it in broad terms that stigma is bad and acceptance is good, but really drill down and get the students thinking of creative ways that they can exhibit those concepts. So things like walking your friend to the counselor's office, still, giving your friend a call after their appointment to see how it went, being able to speak up when you hear people using inappropriate language like crazy and psycho, and what do you actually say? What are the actual words that we should say? What are the actual sentences to shut that kind of language down? So I think thinking in concrete terms for students to actually give them the tools that they can then integrate them into their interactions with one another.
Great. Thank you, Beth. I think that's a good segue to Stan to talk about the program that he's so invested in. Go ahead, Stan.
Great, thanks so much. So I mentioned a little bit about the details of the Directing Change program when we first began, and we're actually going to take just a quick minute and watch one of the films from the program. This is one of our statewide winning films. And in case I didn't mention earlier, we're actually going into our 5th year of the program, and in that time we've received more than 1,600 films from youth around California, from the college age as well as the high school age youth. And we're going to get into it a little bit after the film, but this is just one example how you can, when you give these messages to youth, how you can take those who want to become advocates and change agents and really put them to work for us. So let's go ahead and watch the film. Thanks.
No sound. Maria.
They get it. I get depressed about everything. No one feels like I do. My brother is autistic. No one knows what that's like.
I've been bipolar my whole life. It's so hard on my friends and family.
I have anorexia.
My friends.
My ADD makes it impossible to focus. Don't they get it? I get depressed about everything. No one feels like I do.
My brother is autistic. No one knows what that's like.
I've been bipolar my whole life. It's so hard on my friends and family.
I have anorexia. I can't tell anyone.
I get so anxious. I can't stand it. No one ever seems to care. My OCD annoys everybody. I don't have any friends.
I'm suicidal. Would anyone care if I were gone?
I know what you mean. Sometimes I feel the same way.
Yeah, that's totally me.
Thanks for having my back.
Thanks, and sorry for the little technical glitch. We were worried about some sound problems we were having. Thank you. Stan, you want to talk a little bit about what we just saw?
Yeah, so that was one of the films that was submitted to our Mental Health Matters category, and as I mentioned, we received over 1,000 films. If you go to the website directingchange.org, which is in the handout that's attached to here, and you click on the tab that says Watch and Use Films, we actually have hundreds of films that have been submitted that you can view or download. So if you're doing presentations to youth or adults about mental health or suicide prevention, this is a great way to introduce the topic, to utilize them in their films. There's also a number of resources there as well. If you have any questions, I believe we're going to have a slide at the end that has my contact information, but we would love for these films to get out there. And I think just one quick statement about it would be that you could spend thousands of dollars trying to make a film for youth about mental health or suicide prevention, but these films are already created and they're by youth for youth, and the realness of those messages comes through in the films as you just saw. So please check them out.
And Stan told a really moving story yesterday, which he didn't today, about a student filmmaker who, after the experience of making a film about mental health, went on to become a psychology student. Isn't that right, Stan?
Yeah, absolutely. So we had a young lady who's become a big advocate for Directing Change. She participated in this program the very first year and submitted a film. As a filmmaker, was just concerned about the prize money, wasn't really passionate about mental health, and since then has moved on to college. She switched her major from filmmaking to psychology. She's on the board of her Active Minds chapter there at the school. And I actually recently wrote a letter of recommendation, and she's now a mental health liaison and goes into classrooms and educates her peers and other students about mental health. So again, this is just one example of when it's one thing to go speak to students as they're sitting there passively, but then we want to make sure that we have opportunities like Directing Change or like the NAMI on campus, which you're about to hear from Beth on, that we allow that forum for youth to participate in the movement. And we know that stigma is not as strong in the younger generations, and we want to capitalize on that and allow them to share their voice about mental health and suicide prevention, because we know that these issues are affecting them.
Stan, thank you so much. And before I hand it over to Beth to talk about empowering students and the wonderful work that they're doing at NAMI California, I want to say that our panelists, there's so many questions coming in, such good information being shared. Our panelists are going to stay for another few minutes after the hour. So for anybody who's on the line and wants to stick around, please do. I want to now introduce or hand over to Beth Wolf to talk about how to take this engagement of students and move it to the next level.
Thank you so much. So I want to share a little bit about some of the programs that NAMI has for youth and how those programs are in place and designed to really empower the students and to take the interest and take the enthusiasm that the students have for these topics after getting involved and really put it into action to make change locally. So we have the Ending the Silence program, and for those of you on the call who aren't familiar with it, I highly encourage you to reach out right away to your local NAMI affiliate and get in touch with them to learn more about this program. It is a 50-minute presentation, stigma reduction and mental health education presentation that's given to high school audiences, and it consists of 2 trained presenters. One presenter is a parent or a former educator of someone, a parent of a young person with a mental health condition or a former educator, and they share some of the basics of mental health and mental illness. So they talk about the statistics, they talk about the facts, they dispel the myths, and just really provide a foundation for the students on what is mental health and what is mental illness. Then they also talk about where to go for help. They talk about what's available right there on their campus, what's available in their community, and then state and national resources as well. The second presenter is a young person who they themselves have experienced a mental health condition while they were in high school and are now in recovery and are typically in the 18 to 25, 27-year-old range. So they're that next age group right above the high school students, which we all know is who we all look up to is the folks that are right above. So they share very openly, very honestly, very candidly about their experiences or what could have helped when they were in high school, what friends did or could have done to really support them as they experienced their mental health challenge. So having that open dialogue in a classroom setting with students is the Ending the Silence program in a nutshell, and it's been incredibly impactful throughout California and has really just taken off. And what we're hearing from the teachers and from our presenters is that students are ready for this. They want to talk about these things. They want to be given the opportunity and given the correct terminology and the correct information so that they can have an educated discussion and really become advocates for these topics. So as we presented Ending the Silence over the past several years, we began to hear back from students that, as I just said, they're ready. They want to take this and run with it. And at the time, we didn't really have a next step. So we worked with our California Department of Education and with the Placer County Office of Education and several other community partners, and worked with our affiliates to really get their input and buy-in, and created the NAMI on Campus High School program, which is a mental health awareness club program for high school students. So the goal of the club is to raise awareness. So it's not to diagnose people on campus or administer medications or have support groups. It's really about raising awareness and bringing this subject to the surface, and then also letting students know that this is okay to talk about and where they can go if they or someone they know needs help. So it's just bringing the conversation out of the dark and bringing it to the light and putting it into a place where people feel comfortable discussing it. And then through those clubs over the past couple of years, as we've been piloting the program and piloting the training that goes along with the clubs, the activities and the initiatives and the campaigns the students have created has far and beyond exceeded our expectations for what they would do. They really have become true advocates. We've had student clubs presenting to their school boards about mental health and lobbying for better regulations for suicide pre- and post-vention planning. We've had students creating school-wide campaigns and raising large amounts of funds to donate to local organizations that have a focus on mental health. It's just they have gone and done more than what we originally thought was possible or what we could have even imagined. And so I think that to tie this back into the empowering part, it's about putting this information and the tools into the hands of the students and letting them figure out, with guidance and with help from us as the adults, of course, but really letting them find a platform and find a vehicle that works best for them and for their school and for their peer group. It's one thing for adults to come in and say, this is what this is and this is how it's going to work and you're going to do X, Y, and Z. And that might work to a certain extent, but to come in and say, here are the facts, here's what's going on, and what do you guys think about that? How can we make a difference? What are some ways that we can really make a change in this area, in our world and in our campus, in our community, and let them come up with the ideas and let them really drive their initiatives. It's going to have a lot higher success rate for students to also adopt that, for other students to see it and adopt and register that information. So I think in closing, my thought is to provide those opportunities to your students. Think outside the box about how can we empower students to really take on these different programs and different projects and become part of the change that we've all talked about today. How can we integrate them into some of these discussions and decision making and let their voices really be heard, and start that path of creating these lifelong advocates that our next generation needs.
Thank you, Beth. Thank you so much. I know that the work that NAMI on Campus in high schools is doing is very transformative. So that's fantastic. So let's go. We have some things that have been popping up on our radar here, and I just wanted to bring them to the group for some questions. I know that Beth has a hard stop at 2 o'clock, and our other panelists are able to stay for a few more minutes. So let me just try to bring up some of these topics that are panelists are thinking about. And we talked a lot earlier about not every community, that it's really important to tailor interventions and services to different settings. And one of our audience is asking particularly about frontier settings where resources are so finite, obviously, because the population density is so low. Maybe Olga or Jill, can you talk a little bit about addressing school mental health and in frontier settings?
Yeah, I'm happy to start us off. This is Olga. So certainly it is a challenge, particularly in parts of the country where there are mental health provider shortage areas, or where there aren't as many programs or nonprofit providers implementing interventions. There are, a number of strategies that have been implemented. One of which is, for example, the use of technology and innovations like school-based telemedicine or telepsychiatry as one way that services or specialists are made available to schools and communities where it would be almost impossible or very difficult for families to access those services. Certainly, though, they don't come without their resource needs in terms of, certain needs of technology and still needing someone to coordinate some of those, the access to those services. But that's, been utilized in rural and frontier areas in North Carolina and in New Mexico and other areas that have been used very successfully. So that's just one idea that I wanted to share.
Great. Do any of our other, is that Jill?
Yeah, sorry, this is Jill, and I'll jump in as well. So we have a number of rural school districts who are currently participating in a learning collaborative on school mental health quality improvement with us, and thinking about that very specific question of how do they manage with limited resources that might be in their community. And a lot of them are thinking about how can they partner with other communities around mental health supports, and making sure to be thinking about both those resources that are school employed, so school employed social workers, psychologists, and counselors, but also whether you can partner with community mental health supports to be able to provide some of those school-based services. And that's really what we think about in comprehensive school mental health, and that can be even more critical in rural or frontier areas where resources may be more limited.
Great, thank you. And I think that addresses another question about what you do in the case of a school where there are no mental health resources on site, where there is no school psychologist or school social worker. So I think that's really helpful. Thanks. A question for Stan. Are any of the films that have been developed through the Directing Change program appropriate for K-5 audiences?
Yeah, I would think so, especially knowing that, I would maybe steer away from the suicide prevention films, but there's a lot of mental health films, and knowing that, elementary and middle school students look up to their high school peers, I think that it would send a powerful message about help seeking and stigma reduction. If anybody is interested, they could shoot me an email, stan@suicideispreventable. You see it there on the screen, and I'd be happy to select some films for you. And that goes across the board. If you're looking for a specific film for a specific audience, we have a pretty wide array. And as I mentioned, this year we also introduced the Through the Lens of Culture category, and so we're also starting to receive a number of films in foreign languages. One requirement of that is that they come with subtitles, so we're trying to make the films accessible to the deaf and hard of hearing communities as well.
And Stan, we do have a number of audience members in Indian country. Have you had any submissions in that category from Indian country?
Yeah, I assume you're talking about American Indian, Native American.
Yes.
Oh, yeah, we did get a couple films. One film actually won statewide last year, so it's called Suicide on Indian Country, and again, you can find it at the Watch and Use Films tab under the Through the Lens of Culture heading. But if not, you're very welcome to send me an email and I can connect you. But we're really hoping to get more films identifying not just Native American or American Indian culture, but a lot of other cultures throughout the year.
Great, thank you. And I want to say a quick goodbye and a special thank you to Beth Wolf, who has to go at this point. She had a hard stop at 2, but I see most of our audience is still with us, and so and I thank you for sticking with us the rest of our panel. One question has come up that we had interestingly thought to address as its own topic. One of our audience members would like you to comment on trauma-informed schools. Maybe Jill, would you like to do that?
Sure, I'd be happy to. So yes, there are a number of resources that are available around supporting students who have been exposed to trauma, and we know that in many of our schools that it's not just a subsample of students that a high number of the student population, and so this idea of how do we have schools that have services to support all students and that are trauma informed is something that is important and growing in numbers across the nation. When asked about trauma in schools, I always refer to a number of specific resources around supporting students who have experienced trauma. That there are a couple of different evidence-based programs that are at the Tier 2 as a selected prevention and Tier 3 services. And let me just pull up that website that I typically refer to. Hold on just one moment here, and I'll give you this resource, and we can also share it as well. So one of those interventions is the CBIS intervention, which is a group intervention for students who have been exposed to trauma. The other one is called Bounce Back, and that one is a teacher-led intervention. And those can all be located. I'll jump back in and make sure that our organizers have that website to be able to access, but there are a number of resources around supporting students who have been exposed to trauma.
Great, thank you so much. And can one of you talk a little bit about substance abuse and how to address substance abuse in high school? I know sometimes we think of behavioral health and or mental health, or substance abuse and mental health as separate categories. What about substance abuse being addressed in high schools?
Yeah,
I'm sorry, Stan.
No, go ahead.
I'll say a quick word about that. One is that really we know a lot of local governments and at other levels where we really aren't separating behavioral health, meaning separating mental health and substance use, that they're really very much important to some of the risk factors are very much the same. They're often comorbid and co-occur with individuals who have a number of challenges, both environmentally and personally. And so there are some things going on in schools that, in particular, I mentioned one, evidence-based, or sort of at least where there's growing evidence of its impact. One of which is called ESSA, which is, I think, screening and I just want to call it the right thing.
Brief intervention and referral to treatment.
Treatment, absolutely. So it's an evidence-based practice really used to identify and kind of prevent and even link to appropriate services, particularly adolescents and youth who using what many of us practitioners and others and providers know in terms of using motivational interviewing tools and other evidence-based approaches to really try to reduce problematic use and abuse of substances. So that is, that is an evidence-based approach that's been shown to be very effective among adults, and now it's being really tailored to adolescent populations and is being tested in schools across the country. So I just wanted to mention that.
Great. I think Stan has a follow-up.
I do, yeah. I just wanted to mention that one of the struggles that I think that many substance abuse programs in high schools or prevention programs in high schools do is that they offer a very oversimplified message of don't do drugs, it's bad, don't drink because it's bad. And we need to trust our youth with the more mature version of that message, which is why do they end up there in the first place? And as Olga was mentioning about the crossover between mental health and substance abuse, we know that substance abuse sometimes, yeah, begins as a recreational use into substance abuse, but oftentimes it's self-medication. And so I think that by the nature of having stronger mental health programs and supports for youth will go a long way towards the substance abuse issues as well. But I think we have to be willing to trust our youth with some of these more complicated messages because these are things that they're dealing with.
Great, thank you. And for those of you out there and those of you on the panel who probably don't know this, Kognito recently released a training simulation for healthcare providers and social workers on SBIRT with adolescents. So that's just a throwaway. Anybody who wants to try that program out can email me. I do have one last question, and that last question is around chronic absenteeism. Now we know that absenteeism is a problem for because it means that students aren't learning and students are losing time on task and the opportunity to learn if they're not in school. But what about the effect of mental health support services on absenteeism? Any knowledge or data around that?
Yeah, I'm happy to make a couple comments about that. It's certainly, we're seeing a lot of attention, particularly from both the federal U.S. Department of Ed and then through state agencies, a real focus and kind of select programs looking at how to reduce chronic absenteeism. We know that for young people who have behavioral health challenges, that they are, they have a greater likelihood of being disengaged from school, of eventually dropping out. That's certainly something we want to prevent because we know the health and economic and mental health implications long term are much more dire for individuals who don't complete high school. And so it is a way for those of us in health and public health to really make a strong case around meeting educational objectives and how these things are really so closely tied together that an initiative or an approach to address chronic absenteeism, absolutely needs to be thinking about the how to address the health, physical health and mental health needs and substance use needs of those young people, which will differ certainly by community, it will differ by grade level, and it may differ year by year because in some of our schools we know that there's a high, mobility rate, and so that you have sometimes very different populations of kids coming in. And so I think that for those, there are a lot of schools that are really already doing this with their partners. And it's, again, for those of you who are school mental health advocates, I think it's a very good hook and a good way to have your local decision makers, whether in education or local government, administration, to think about how school mental health, the broad continuum of care, can be part of the solution around to address chronic absenteeism.
Perfect, great. And Stan has a quick follow-up.
Yeah, and actually it echoes Jill's point, which is that sometimes when we're trying to promote or integrate mental health programs into our schools, we need to look for that hook, as Joe called it. And so I think that, you're going to have your automatic champions who are all for it, but I think we need to remember that, the stronger the mental health is in our students, you're going to get those hooks like less absenteeism, less substance abuse, better performance, and also in the long run, ultimately, probably save some money. So just to encourage folks that sometimes you have to use these things to make your point across. So again, just to echo Jill's point, that these are great hooks, that the stronger the mental health of your students, the stronger you're going to be in a lot of other areas that schools do have to care about.
Right. We have a quick question that I think Stan you might know the answer to. Does NAMI offer any resources for the K-5 level? I think they do. Can you confirm?
They have a program called Parents and Teachers and Allies, which would also be applicable at the K-12 setting. I'm not sure that they have any programs at this point that go in directly to talk to elementary age students, but the Parents and Teachers and Allies is a way to get the staff engaged, and I'm sure Beth would have a more definitive answer on any program that's directly for youth. But I think when from the programs I've seen that focus on, younger kids' mental health, a lot of the times it's more focused on when you're feeling down, when you're feeling blue, and those types of messages. But I would probably reach out to Beth on that to confirm.
Okay. We still have quite a few people on the line, but I think it's time to wrap it up, and I want to give everybody a last chance to say a last word. So let's start and go backwards. So let's start with you, Stan.
Yeah, thanks everyone for being here today. Thanks to Jennifer and Kognito for having us. I would just encourage everyone that sometimes it's easy to get discouraged or distracted when we seem like we're always pushing the boulder up the hill, but that mental health and suicide prevention in our schools are part of the school's responsibility is to keep kids safe, and that these efforts require vigilant attention. So just keep pushing and keep up the good work.
Great. And Jill?
Yeah, just thank you for organizing this and for everyone participating. I know that many of the participants are likely our frontline providers that are out in the field doing this work. And so thank you for that. And just want to encourage you that, that you are not alone in this work, that there are many folks across the country doing this work, and that's why we really focus on looking at this at the national scale. So I'll encourage folks who are on the line to remember to go ahead and join us on the SHAPE system so you can be connected with other colleagues who are doing this work across the country and have your school counted in the National School Mental Health Census.
And before I go over to Olga, I'll just say that Jill's organization, the Center for School Mental Health, is also the organizers for the Advancing School Mental Health Conference that's taking place at the end of this month in San Diego. I would highly encourage anybody in this field to attend that. It's a fantastic way to learn. And with that, let me go back to Olga.
Thank you so much. It was a pleasure to be with everyone and to be a part of this panel, and thank you for hanging in there with us. I think my final point might be just to even kind of address again the stigma that I think makes it difficult for folks to access when there are available services, both stigma that may be coming from the individual or from institutions or from kind of social norms. And that our language and our, I think, approaches to this really need to be mindful of the fact that these are things that we all need to be thinking about. My favorite quote that I wanted to share from Lynn Fridley, who is a researcher from the UK, says, everyone has mental health needs, whether or not they have a mental illness, just as everyone has physical health needs, whether or not they are sick. And so that's just an important thing for all of us to remember, that we're really in this together.
Indeed. Thank you so much. Thank you to all of our panel for giving of yourselves, giving of your time and expertise, and for the wonderful work that you lead both locally and nationally. And thank you to all of you who have hung out well past the time to stay with us, learn, take back some really valuable knowledge and inspiration to the work that you do every day for supporting youth mental health. So thanks to everybody, and look for an email from Kognito with the information from today's panel. We'll go back and circle back with all of our panelists so we make sure we have all of the references for you, and even answer maybe a couple of extra questions that have trailed in just at the end of the day here. So thank you, thank you, thank you to everybody. Have a great day.